I'm just going to introduce the panel. So you've met Robert, Charlotta, Martin Dockrell, third from the end, I think will be familiar to most of you from Public Health England. We've got a change in the programme actually. Instead of Penny Woods, it's Steve Wibberley, who's the COO from British Lung Foundation, Sarah Jakes of VAPOR, and Ricardo, who you know. So we've heard a variety of views on the potential health risks of e-cigarettes in this session. I haven't heard anyone say that they're equal risks to cigarette smoking. Indeed, the Daily Mail, who we keep talking about, issued a correction to say that no experts had actually said that. So I'm starting with the premise here that the health risks of e-cigarettes are lower than cigarette smoking. John talked about much less. Charlotta, you talked about probably, but and Ricardo talked about health improvements. But I'll leave the panel to challenge that view if they would like to. But what we want to really come back to here is an issue that is of concern, that the health perceptions are going in the wrong way. And this is just some evidence from some studies that I've been involved in, which has been showing how over the years the perception that e-cigarettes are equally harmful to tobacco cigarettes has been growing, and this is very consistent in different surveys. So that's the Internet cohort survey that we're involved in, the ASH data, and also use surveys. So a remarkably consistent finding, which is of concern. So the question is, should we, and how, if we agree that we should, communicate the relative risks of smoking versus electronic cigarettes? And like before, I'm just going to ask the panel in 1 minute to just summarise their views on that, if that's possible. So thank you. Shall we start, Ricardo, with you? Just 1 minute, very briefly, please.
This perception story is very damaging because perception shifts according to what is being communicated to people, especially to vapers. And that links once again to the data that Robert was showing this morning, the grey line, segmented line of what is the effect of the perception of risk. If the perception of risk is in the hand of unscrupulous journalists, the effect will be to see big swifts in the perception of this risk. But if this is put back on the end of public health, let's say Public Health England, or the medical community, we shouldn't be seeing such large shift because there are now evidence that the risk is not as important and surely much less important than tobacco cigarette.
Okay, thank you. Sarah.
Well, as a consumer, I'm the person being communicated to, and I had a load of notes that I was going to say when I read this question, all of which I've thrown out after listening to things this morning in favour of what's really a sort of a mini rant. I mean, basically, the only thing that's important here is how consumers perceive e-cigarettes. And so any communication has got to be effective, accurate as it can be based on the evidence, but it's also got to be within a framework that a consumer understands. Now, I'm not a rat or a mouse, and I'm certainly not a zebrafish. And it's easy to think that those sort of studies, they stay within the walls of public health, and they don't seep out into the public consciousness, but they do. We're more and more seeing these sort of things in the Daily Mail, and so it's very important that these sort of perceptions are corrected. And I think the PHE report went a very, very long way to doing that. One of the things that's been concerning me lately as well is the histrionics over conflict of interests, which has also seeped into the public consciousness as well. It's incredibly unhelpful to see respected public health people basically eating each other alive because they were once seen in the same room as somebody who had, I don't know, a friend who was a tobacco executive. I mean, for the public, really it comes down to what they want to know is the conclusion from this study valid? If it isn't, tell me why it isn't. Don't just say to me that it can't be valid because this particular person said it. Tell me why it's valid. Tell me how it applies to me. I think another part of this question also is who communicates it. Public Health England, as I've already said, have gone a long way to putting the information out there. But there's also people within the industry. There's a guy sitting at the back of the room, actually, Ian Green, who is one of the most passionate people I know on the subject of helping smokers switch to vaping. And yet, because he owns a vape shop in Southampton, he is unable to communicate the message, even that e-cigarettes are safer than cigarettes, because of the COP rules. So if vape shops aren't allowed to do it, who is going to do it, and why aren't they doing it more?
Okay, thank you.
Okay. I think to start with, we shouldn't pretend that e-cigarettes are unique in the complexity of communicating risks, benefit and efficacy. So in the papers this morning, there was something around the relative benefits of hormone replacement therapy for women with menopause symptoms. And it's the same thing. It's the balance of risk. So it's not unique, but what do we need to be able to be effective at communicating that balance of risks and benefit to the public, and whether that's on an individual basis, a healthcare professional talking to an individual who might want to quit smoking, or on a population basis. And I think there's a number of things we probably need to be putting in place to make sure we communicate that benefit and risk balance as well as we can. First of all, it's about having the evidence. And I think we've moved a long way with the Public Health England report around being able to consolidate some of that best evidence. But I think we've heard today about some of the challenges, that there's still an awful lot of things that are either disagreed or we don't know about. But if we can consolidate and get some consensus around the evidence, that's one thing. I think working with people who are trusted, whether that's healthcare professionals, charities, Public Health England, people who are trusted as communicators, is really important. And then the really tricky bit is about the fundamental of communicating risk. So when you're looking at breast screening, how do you communicate that risk and the benefits versus the negatives of false positives? And that's not easy. But I think the sort of conversations we're having today really help us understand that. And I think the principle around saying we might not know exactly how much safer e-cigarettes are than ordinary cigarettes, but they are fundamentally significantly safer, is the important way we should be communicating. And the final point, building on Sarah's, if we want to communicate something to people as a health charity, what do? We start talking to them to understand what they want to know. And I'd argue it wasn't just talking to vapers, it was about talking to smokers and talking to the general public about what they want to know, so we can start answering some of those questions.
Thank you, Steve. Martin.
Sarah provokes me into making a direct declaration of conflict of interest. Not any of the paranoid nonsense you might have read about me being a secret agent for the tobacco industry over the last few years. But rather that this will come as a surprise to some of you, I have strongly held views on this issue. And those strongly held views sometimes lead me to select the data, so I seize upon the data which reinforces my views, which people who agree with me, and I listen to people who disagree with me only long enough to prove them wrong, at least in my own head. So I'm particularly glad that Charlotte came today and I had the chance to shut up and listen. On this issue of the communicating risk, you'll all want to hear the latest from my family. They always ask me about my family at these events. And I was sat on the bus with my sister, not the sister who's a vapor, but the sister who continues to smoke but has started to vape. And over the last year, she was vaping a lot more than she was smoking. In fact, I thought she'd completely stopped smoking. And we were sat on the bus, and she had in each hand, in one hand she had her Tank model e-cigarette, and in the other hand she had a packet of 10 Silk Cut. And she said to me, Martin, I just don't know which is riskier. You should not have to be my sister or on a bus with me to get the facts about the relative risks of e-cigarettes. And I don't know what, Charlotte, you would have said to your sister if she was a 30-year-old, a 30-year-long smoker thinking of switching to vaping, or trying to switch to vaping. I'm not sure that we got it 100% right at PHE. It was, I think, the first time a public national organisation went out and tried to get this message across. We're always trying to get things better. And we looked at how we could phrase this kind of 95% figure. Should we talk about 5% of the risk? So we're talking about relative risk rather than relative safety. We don't want to talk about safety in terms of cigarettes. Or should we use vulgar fractions or ratios? Marcus had a really catchy phrase that he used earlier. The risk is non-zero, but several magnitudes less than smoking. We wouldn't have got many headlines if we'd used that. We wouldn't have reached many smokers if we had used that phrase. And I think it is absolutely crucial to reach these smokers, particularly, and the data that we've seen, which shows that actually fear that e-cigarettes are no safer than smoking is strongly correlated with never trying an e-cigarette among daily smokers.
Thanks, Martin. Charlotte.
Yes, I'm one of the bad guys today. Well, it is very easy to compare one product as a cigarette with an e-cigarette. I completely agree that the e-cigarette is less harmful in my eyes, what I have read. So far, so good. I think it is very difficult to communicate this because that depends on the situation and whom you are communicating with. If you are talking with a very reluctant smoker, for example, in a mentally ill person not wanting to quit and so on, of course, I believe there would be a benefit in health for him or her to switch. But we must never forget to view this in a public health perspective. And in contrary to others, I'm not very convinced of the harm reduction strategy. I know that the snus in use in Sweden and the decline in smoking prevalence is always shown. What is not shown is that in the states of United States, the states with the highest snus use also have the highest smoking prevalence. So we have to view this very complex picture and try to communicate it in different settings in different ways. I'm very concerned that there is this dual use, and in Denmark, half of the dual users have not reduced their tobacco consumption. So they will have an increased risk. And I'm also very concerned of the longitudinal studies that now show that it seems that e-cigarette use undermine smoking cessation. So we have to combine this whole picture and try to communicate it as good as we can. And of course, the best thing is to quit smoking, and I think this should be the primary target of us, never to forget that there is an even better alternative to smoking, and that is quitting.
Thank you, Charlotte, and then finally Robert.
My view is that you get the greatest clarity if you're speaking as a scientist or a public health expert, if you're specific, and I think it's perfectly reasonable and you can encapsulate what you say and communicate it when you talk about what the source is of the data that you're using. So when someone says, on the basis of the concentrations of toxins in the vapor that comes from electronic cigarettes, I would expect them to be an order of magnitude, possibly 2 orders of magnitude, or considerably safer than cigarette smoking, but not completely safe. I think that's a message that people can understand, and it's clear the basis on which you're making that statement. You're not saying, I am absolutely certain that this will be the case and that we will never, I will never change my mind on this if the epidemiology subsequently shows this not to be true. I think that's an accurate statement. I think that we have to be very careful as scientists and public health experts never to use the kind of language that tabloid newspapers or even broadsheet newspapers use. Journalists have a certain kind of language which they use, which is intended to, is polemic, and it's intended to very often to persuade people of a particular message. I think our job is to communicate information, and we should do that as accurately and specifically as we possibly can. And when people misinterpret it or misunderstand it, then we have a responsibility to try to correct that. And I think that one of the things that is probably, I think, actually more harmful than anything specifically around e-cigarettes is the way that I can completely understand it because of the emotions and the passion, but the way in which some parts of our community, who should be friends and allies, are feeling so upset or annoyed about the way that other parts of the community are behaving that we start to attack each other. And so I think we can do a lot better than that, and always remember that we are not, my job is not even to make recommendations about things. My job is to try to convey information, find out the facts, to try and communicate it dispassionately, and then participate subsequently in that debate. But there's one other thing, if I may. Sorry, one other thing. There is a presumption out there that the predominant way in which people are going to use e-cigarettes is to switch from a tobacco product indefinitely to use of an electronic cigarette. That's not what we're seeing, and at the moment anyway. And that's so a lot of people are using them rather like they're using a sort of souped-up nicotine replacement product, licensed product. They're using them for a while, and then they're cutting down or stopping using them altogether. And I think we need to remember that e-cigarettes are not just a permanent switching tool, but actually probably even more commonly as a sort of being used as a nicotine replacement product. And one of the things to bear in mind is that most smokers really don't want, some smokers are fine with it, but most smokers, one of the things when you say about the harms of nicotine, they cite nicotine addiction as a harm. They don't want to be nicotine addicted. And so they see this, like we saw, I've always seen nicotine replacement therapy, as a transition from being a smoker to being someone who's completely nicotine free.
For those people on the debating panels this afternoon, I let you run over the 1 minute because this was very complicated. I'm not going to allow that this afternoon. Okay, let's open it up to the floor. I've seen two people with questions, and I can see this is going to generate a lot of debate.
First of all, wanted to start by congratulating Public Health England and Anne for the report, which I think was really important. Having congratulated you, I will go on to say that I don't think the use of the 95% was particularly helpful for two reasons. One is it was over-specific for a scientific audience, which opened it up to criticism. Maybe that they're actually safer than 95% or slightly less safer. It doesn't really matter. They are substantially, very substantially less safe, more safe, but it did open you up to attack. But more important from my point of view, and I used to have a role communicating risk to consumers about financial products, and if you think e-cigarettes is difficult, you should try that. And some of the research we did showed that something like 50% of the general public don't understand what 50% means. And what I mean by that, and this is really important, is that, for example, we have something called the annual percentage rate on loans, right? A lot of people think the higher it is, the better it is. I hope most of this audience understand that's not the case. I also found some research in America which showed that even college graduates, about a quarter of them, don't understand percentages. So please, a plea to Public Health England, because you've got a marketing budget, which Ash doesn't have. Can you consumer test messages going forward to find out actually what works for the general public?
Okay, yes, go on, answer.
Won't be surprised to hear that Deborah and I have had this discussion more than once before. And the 50% gag, that's my gag that she's...
Okay.
No, I'm sorry, I was using it 10 years before I met.
We've got some people here.
I think the question of whether you use percentage of vulgar fractions, I'm not sure that people understand vulgar fractions any better. But it turns out, Deborah, that we weren't attacked for the use of percentages, not very much anyway, because actually Anne's line in the report was very clear. She simply said that this estimate remains reasonable. What we were attacked for was a supposed support from the tobacco industry that somehow we were recycling tobacco industry arguments. And that is overwhelmingly what we've been attacked for, and I think inappropriately.
Thank you. And I just want to also remind people there were other co-authors of the report. I don't want to take all the acclaim or all the opprobrium. Robert talked about orders of magnitude. So, I mean, would the public understand that any better? So we really need to think this through. We probably won't have time now, but let's take as many points as we can, and then I'll probably ask the board for final comments.
Great. Thanks very much. I will just say that thanks to the organizers for putting together this incredible program, and also to the participants for a really highly engaging session that's only halfway done. So I think if nothing else, the tobacco industry has been very successful at marketing their products to all segments of the population. And because of that, cigarette has really become a unique term in our language that means a unique thing and only one thing to people. And I think there's a lot of confusion when we use that term to say e-cigarettes and cigarettes. So when I see this kind of funny thing with the people saying, well, I think it's equally as harmful as cigarettes, to me, it's not really surprising, but I think if you're not close to this topic at all and you just think, I'm being asked a question about cigarettes and e-cigarettes, cigarette is a cigarette. And if I don't really understand what the difference is, then I know a cigarette is something that causes cancer and it's smoking and things like that. So on this topic of the communication of how to get the message out there about these things are less harmful, maybe tidying up the terminology is central to that. And I think even if you ask the people who use those devices, they won't say they're an e-cigarette smoker. They'll say they're a vapor.
Sorry, could you say who you are? Sorry.
Jonathan Dugas from Vitality.
Okay, thank you. Okay, hands up, please, so we can get through as many, and then we'll ask the board to final comments.
Okay.
Hi. Clive Bates again. I mean, when we talk about risk, magnitude really does matter, okay? And I just, three or four observations, that's very quickly. First of all, if you say something is substantially lower, it's meaningless, basically. It can mean 20% lower, 40% lower, 80% lower, or 98% lower. Probably only one of those is approximately right for e-cigarettes in a comparison to cigarettes, okay? And so statements like substantially low are basically misleading because they don't really have any meaning within them. Secondly, Charlotte, I mean, you put up a very interesting kind of blizzard of studies, but again, magnitude matters, as Marcus was saying earlier. You know, are these tiny risks, trivial risks, non-existent risks, material risks, or serious risks? So what I felt was missing was some framework for evaluating harm or risk that you take from those studies and turn into a meaningful assessment of the risks of these products. John Britton, if he was here, I'd say roughly the same thing. Yes, you've got a list of unquantified risks that may happen later in life. But, you know, are those tiny risks or large risks? Quantification is important. And to be honest, Deborah, percentages, APRs are very hard to understand. Percentages, I think to argue that consumers are too stupid to understand percentages is going a bit far, to be honest. Okay,
can we please keep the contributions short? This is going to start eating into your lunch hour. So bear that in mind when you put your hands up, please. So really urgent and quick, please. Okay, someone's got the mic.
Okay, Steve Stotesbury from Imperial Tobacco. I just wanted to say I really appreciated John Britton's talk, who's not here, from at least the point of view that it's a timely reminder to manufacturers to shut their mouths on risk reduction. You know, they are not the ones to communicate this. And really, it's for others to communicate that.
Okay.
No, John made a challenge about standardisation, which I think is right, and I'd really appreciate that perspective in the SEN standardisation effort that's going on. And really, my challenge is to those, you know, on the panel, it's really good to have reports and to put things out into the public domain and create evidence, but I'd really like to see those evidence makers getting involved in policy making as well. I think you've all got an important role in developing policy and developing standards, and to get involved in that. Thank you.
Okay, I'm going to take two more comments. I saw somebody at the back who's got the mic now.
I can't.
I think Martin Dockrell got it absolutely right on 95%. I'm Ian Gregory. I'm a lobbyist for e-cigarettes, and I helped to run the all-party parliamentary group on e-cigarettes. The 95% thing communicated to exactly the right people, which are smokers trying to work out how safe e-cigarettes were. They were queuing up at the e-cigarette shops. There was a huge spike in demand straight afterwards. You got it exactly right.
Okay, and Konstantinos, one final comment.
Yes. My comment is related to Professor Pissinger's presentation. A lot of laboratory studies, large body of evidence for many things. For e-cigarettes causing damage, for nicotine causing cancer, for nicotine causing atherosclerosis. The problem is this with e-cigarette. There is not a single study, even on animals, which addresses realistic use, which means exposure to smoking for a long time, and then either switch to e-cigarette use, switch to nothing, or become dual user. Not a single study has been published which assesses this realistic scenario. The second is that the animal research is a very fascinating thing, where we've seen miracles happening every day, but nothing is related to humans. Recently, Marfan syndrome was cured in mice by using losartan, a simple antihypertensive. When the clinical study was done, 0.0000 effect on humans. The studies on asthma. I think it's a paradox to discuss and to present an animal study showing that mice can develop asthma. In fact, they didn't develop asthma. They had some changes in the lungs which are associated with asthma, while Ricardo did a clinical study in asthmatics and found that switching reverses damage. So I think that there's, and that's the end. I don't have anything else, but I think that there's a confusion.
Okay, I'd like to give the panel, the opportunity for any final comments. Please keep them short. Go on, stop.
I would like to try to address all the questions that came from the podium, but let's start with the 95% figure, which may be highly incorrect, and you know why. I was in the panel, and when we were asked that question, we thought of exclusive electronic cigarette use. But now we know that 80% of electronic cigarette users are in fact dual users. So maybe people is not that incorrect in saying, you know, that the risk may be equal. Fact is that we need also to redefine dual usage. Is intermittent dual usage? Is heavy dual reduction? Is, you know, they are different. In fact, the clinical studies are already showing that if you don't reduce by a certain level, you will not see health outcomes. But if you do reduce by more than 75–80% from baseline, you do see the same exact health outcomes that you would see if you quit completely. Final point. On the opposite side, there are, as Robert was saying, there are a lot of vapers who actually quit vaping as well. So it's they are empowering their willingness to change their smoking behavior, and eventually they find themselves the self-efficacy that they were missing without the electronic cigarettes. And this is also needs to be highlighted in the survey studies in some way.
Thank you. Very quickly, please.
I'd just like to pick up on Deborah's point about percentages and the perception of the public. I mean, for me personally, percentages is probably the easiest one to understand, but then I was in the money markets for 15 years. So I think Deborah's absolutely right in that possibly what needs to be looked at is what messages work for the public, but also not just in perception of relative risk. There's other areas. I mean, perhaps anecdotal, you know, stories from vapers, that sort of thing. And, you know, we need to find out what works best.
Okay, Steve, thank you.
And just agreeing with Sarah's point, rather than us trying to guess what the public understand, what people respond to, there's a whole industry of marketeers who can help us craft messages, test messages to make sure we're communicating what is a complex, difficult issue, to make sure we're communicating that as well as possible to people, so we can help people help inform people's behaviour changes.
So I'd like to echo Ricardo's comment about dual use. Not only is dual use not a kind of binary thing where you're either a dual user or you're not, nor is it a fixed thing. People go through a whole, they're on a journey. And the Ash YouGov data, I think, finds more people who no longer neither smoke nor vape, but have done both, than they have, than they do that 1.1 million vapors. Right? So that's vapors, non-smokers, single users. And Carol also mentioned briefly in her presentation that why these are not cigarettes. We shouldn't be comparing them with cigarettes all the time. I would suggest that in terms of looking at the risk, we should always contextualize them with the comparison with cigarettes. But in terms of regulation, Carlos is completely right. They're not cigarettes, and we probably shouldn't be routinely regulating them as if they were.
Well, it is complex, as I said, and we should keep on looking at the evidence which is coming now. More and more studies are coming, and we are just in the early phase of this, and things might change. And I would be the first to be happy to change my mind. Let's see.
So, and I think we must all be. On the, I guess my main point, at the risk of just repeating myself and being boring, is that if anyone is going to be specific and accurate and clear and careful in our analysis, it's got to be us. And if we're not, then no one will be. So when it comes to, for example, the very complex issue about to the extent to which e-cigarettes are promoting or undermining cessation, which I think is actually one of the most important issues, then we have to pay very close attention to the problems of observational data that we're using. It's not to say that you can't make causal attributions for observational data. We do it with lung cancer, and rightly so. But we have to do it very carefully. And when new data comes out, we have to take that on board. So I'm very conscious of the data that's come out of Anne's group. Around dual use and subsequent quitting, and the difference between the different models of e-cigarette and daily versus non-daily use, which that needs to be replicated. But I think it's very important, and I think we mustn't necessarily take it for granted that in the population as a whole that e-cigarettes are going to promote cessation, or the reverse. We need to study it very carefully. But one thing I have to say I am reasonably convinced of, I'm still willing to change my mind, and that is that if someone uses an e-cigarette to stop smoking completely in a quit attempt, that the effect size is probably broadly similar to the other kinds of methods that we're using, like medicinal or nicotine obtained on prescription, dual form NRT, whatever. Now, it may be that for some people it's better, and it may attract a different audience. But I think, as I say, we need to be very careful and specific and cautious in the way we express our findings.
Okay, a lot of people had their hands up, so we'll just put it to a vote. Should we be trying to communicate relative risks of these two products? Yes. I suspect this is going to be pretty unanimous. Hands down, no. It is. Okay.